Dr. Blackstock, always good to have you. Let's start with what we just heard from Allison there on the Delta variant. CDC Director Dr. Rachel Maddow talking about that on ABC this morning. Here's part of what she had to say.
It is more transmissible. It's more transmissible than the Alpha variant or the UK variant that we have here. We saw that quickly become the dominant strain in a period of 1 or 2 months, and I anticipate that is going to be what happens with the Delta strain here.
Dr. Blackstock, how worried are you about this Delta variant?
So I'm concerned, Craig. This is the worst and scariest variant yet. As Dr. Walensky said, it's more transmissible than the Alpha variant, which was also transmissible. And there's also evidence that it causes more severe disease. And we also know that in people who are unvaccinated and partially vaccinated, they can still be infected and get seriously ill. We saw what happened with the spike in India, with the spike in the UK. We're seeing even now here in the US, a lot of young unvaccinated people ending up in the ICU. And so this push over the next few weeks is important overall because of the pandemic, but there's even more urgency because of this Delta variant.
Dr. Blackstock, when you say it's more transmissible, does that mean that, and I'm just using this number because it's a round number. Let's just say it takes 10 seconds in a normal setting for COVID to be spread. With this new variant, does that mean it's spread with 5 seconds of exposure? Not to oversimplify it. Well,
it's more likely to spread. Like one person can infect 4 people, for example. So if someone is standing close to someone and they have a less transmissible variant, they may not be infected. But this variant, as Allison had said earlier, seeing whole households infected with this variant as opposed to just 2 or 3 people.
CDC data shows right now about 10%, roughly 18 million Americans have gotten their first dose, but they, for whatever reason, didn't go back to get their second shot. Clear up some confusion. If you missed that first dose, let's say you're supposed to go back on a Monday or Tuesday, can you go back 2 or 3 weeks later, a month later, and that second dose is still effective?
Yes, absolutely. Even if people go back for their second dose outside of that 3 and 4 week window for the mRNA vaccines, that second dose is still highly effective. Even 2 or 3 months later. But what we really do want, especially because of this Delta variant, for people to get both doses of their vaccine. And I think that what we're seeing is that there are some problems with messaging around the importance of that second vaccine. I know also people have expressed some fear about side effects with that second vaccine because you're more likely to experience vaccine side effects the second time. But I think that we have to really communicate over the next few weeks that that second dose is key to being fully immunized.
The Biden administration announcing on Thursday that it plans to invest about $3.2 billion to build up this country's supply of drugs to treat COVID and to treat future viral threats. The Department of Health and Human Services saying that the money is going to go toward clinical trials, the manufacturing of promising treatments for COVID to prevent future surges. What did you make of that announcement yesterday?
No, I think it's important. We still don't have a cure for COVID. Vaccines are sort of a preventive measure, but we don't have a cure yet. And we know that there are a significant number of Americans that even when they're vaccinated, don't develop an immune response to coronavirus. And so for those people, we're going to need to make sure that we have therapeutics available, even a pill that we can give within days of being infected. That can be effective against developing really severe symptoms and disease from coronavirus. So I think that this investment is timely. I think it's much needed because we also know that coronavirus will probably be with us, an endemic in the population for some time.
Dr. Uche Blackstock, we'll have to leave it there. Dr. Blackstock, have a great weekend. Thank you for your time.
You too.